Well, we initiated the HUG clinic in order to kind of meld our two programs together. So that's Diagnostic Medical Sonography and Physical Therapy Assisting. And our goal was to kind of create some connection between the two in a clinical setting. We're gotten a really very positive response because our services are different than your typical medical clinic. They offer things that normally the community and the people within the community don't get free services for. So the diagnostics for prenatal care and the physical therapy is something that usually they just don't have access to. So it's been a really great addition to the free services that we offer in the community.
So one of the big advantages that our students will have going out into the workforce, not only as students but as graduates, they will have training on electronic health records. So they're going to be well prepared in the use of that technology prior to going out into the workforce. In the program, in the ultrasound program, the students learn how to do ultrasound by scanning each other. So once they learn normal, they want to kind of get out of that perfect patient scenario. And they don't have that opportunity until they hit their clinical site, and then they get overwhelmed. So the HUG clinic allows the students to be able to see real people prior to going out into their clinical environment, and that's really exciting for them. The other advantage of the HUG clinic is that they're able to do examinations that they may not be able to perform or not get as many examinations out in their clinical environment. Big one would be obstetrics. We're going to get a lot of obstetrical exams here, and the musculoskeletal examinations as well. That's not really performed out in the clinical environment at this time. So new examinations are really advantageous for the students.
Well, the HUG clinic in and of itself, that it is healthcare programs that are united. It's a very new concept. The two types of services offered have never been combined like this before.
And a goal of all of allied health is actually to be able to intermingle students from different disciplines, because that's where healthcare is headed. To be able to have our students work and communicate with other students in different programs, that is also going to provide the clinical sites with a really effective student. And so that was another impetus for the development of the clinic.
So it was kind of twofold when we started to have this idea of a clinic unfold in front of us, because we saw the need for our students to have that clinical education as part of the didactic curriculum, so as part of their school work, so they can actually utilize the stuff that they're learning in the classroom immediately afterwards. So we saw that need, and then where GateWay is located at is in an underserved area, and there's a lot of community partners in that area, in this area, that could use the type of services that we're offering. So we saw this as a very good relationship to build. Our students get more clinical hours, they get better at their jobs, and the community benefits from the free services that we're able to offer. So it's a win-win situation.